Welcome back to VisaPathway UK, your trusted source for visa news, immigration policy updates, and insights that matter most to migrants and families across the UK and beyond. Today's video covers one of the strongest immigration responses we've seen yet, and it's coming directly from Scotland's government. In the middle of sweeping UK-wide immigration reforms, including the controversial closure of new care worker visas, removal of dependent rights, and massive salary threshold increases, the Scottish government has officially said, enough is enough. They've just released a detailed 31-page policy document titled UK Immigration White Paper 2025 Scottish Government Proposals. And in that official paper, they've outlined a sharp, evidence-based critique of the UK's current system, especially around the skilled worker and health and care routes, and are now demanding specific exemptions and rule changes for Scotland. This isn't just political talk. It's a carefully researched proposal backed by data, real-world impact, and urgent demands to fix what they say is broken. One of the most shocking revelations? Health and care worker visa applications fell by 81% between May 2024 and January 2025. That's from the Scottish government's own white paper, and it highlights just how devastating the UK government's recent policy changes have been, particularly for care homes, the NHS, and migrant workers in Scotland. And it gets even more serious. The Scottish government is now officially requesting that the UK Home Office do something no other region has been granted: restore dependent visas for care workers in Scotland to improve recruitment and retention. That's a direct quote. And it's one of several bold recommendations that signal a growing divide between Scotland and Westminster on immigration. In this video, we'll unpack Scotland's full response, including why they believe the current UK system is damaging their care sector, what specific changes they're asking for, including bringing back dependents, adjusting salary rules, and refunding NHS workers, and what all of this could mean for migrants, employers, and future care visa applicants. If you're a care worker, a sponsor, or simply someone trying to understand how the UK's immigration system is evolving, especially in Scotland, this is a must-watch. Let's dive into the full breakdown of this powerful Scottish government response and why it could shape the future of migration north of the border. Section 1. What's happening with the care visa route? To truly understand why the Scottish government is pushing back so strongly, we need to first look at what changed with the UK's immigration policy, specifically the health and care worker visa route, and why these changes have caused such an uproar. Let's begin with what's already happened. In early 2024, the UK government announced a series of sweeping immigration changes. Among the most controversial were the ban on new care workers bringing dependents, including spouses and children, a significant increase in the salary threshold for skilled worker visas, rising to £38,700 and even higher for family sponsorship routes, a tightening of the eligibility criteria for sponsors, including care homes and staffing agencies. These changes were framed by the UK government as necessary to reduce net migration. But in reality, for care providers and local councils in Scotland, and for thousands of migrant workers, these changes have triggered a staffing and retention crisis. In fact, the Scottish government has now publicly confirmed just how devastating these changes have been. In their own words, and this is a direct quote, health and care worker visa applications fell by 81% between May 2024 and January 2025. Let's pause on that. An 81% drop in visa applications in just 8 months. That's not a slow decline, that's a cliff edge. And we're not just talking about numbers, we're talking about real people. People who trained, applied, and planned their future in the UK. Employers who invested in the sponsorship process and offered legitimate jobs. And vulnerable adults and elderly patients across Scotland, many in rural communities, who now face longer wait times, reduced care, or even no care at all. The Scottish government doesn't mince words. They clearly state, stakeholder engagement continues to tell of difficulties in recruiting sufficient numbers of care workers to meet the needs of the sector in Scotland. This isn't just a future risk. It's already happening. And it's happening because of policies made in Westminster. Policies Scotland says are not designed for the realities of their local economy and workforce. They argue that the UK's immigration approach is one size fits all, and that it disproportionately harms areas like Scotland, where population growth and workforce planning are completely different from London and the Southeast. And that's why the Scottish government is fighting back, not with slogans, but with facts, evidence, and direct calls for change. Section 2. Scotland's demands: bring back dependent visas. Now that we've seen the damage caused by the new UK rules, what is Scotland actually asking for? Well, in its July 2025 immigration proposal, the Scottish government made one of its boldest demands yet. The Home Office should restore dependent visas for care workers in Scotland to improve recruitment and retention. Let that sink in. Scotland is asking the UK government to bring back the right for care workers in Scotland to live with their families, even if that right is still blocked in the rest of the UK. Why? Because for many migrants, the decision to move abroad isn't just about a job. It's about building a life, and without family, many simply won't come. Scotland sees this as a key reason for the 81% collapse in visa numbers. They also highlight how current policies are undermining rural care services, where staff shortages are already severe, and argue that a Scotland-only exemption would make a huge difference. To quote the paper again, "It would be proportionate and appropriate for the UK government to introduce a Scottish exemption to the ban on dependents for student and health and care visa routes. This exemption would apply only to Scotland, allowing it to fill roles, stabilize care staffing, and support local communities that are being hit hardest by the cuts. And remember, this isn't about opening borders, it's about fixing a broken system and giving Scotland the flexibility to meet its own needs." Section 3. Scotland demands IHS refunds for all care workers. Another major point raised by the Scottish government is the cost burden placed on health and care workers, specifically the Immigration Health Surcharge, also known as the IHS. Right now, most overseas care workers in the UK must pay £1,035 per year, upfront, just to access the very healthcare system they work in. And here's the issue. Only certain categories of workers get that fee reimbursed, typically registered nurses or doctors. But what about care assistants, support staff, or domestic care workers? Scotland says that's deeply unfair, and they want it fixed. In their own words, the Department of Health and Social Care should ensure IHS reimbursement covers all frontline health and care workers, regardless of registration status. This means that anyone working on the front lines of the NHS or care homes, whether they're registered with a medical body or not, should receive a refund for the IHS. Why is this so important? Because many of the workers affected, like care assistants or senior carers, earn below £26,000 a year. Paying over £1,000 annually for healthcare they're helping deliver is a serious financial burden. Scotland also argues that this unfair policy is harming recruitment. Workers are less likely to stay long-term if they feel financially penalized just for doing essential jobs. They make this crystal clear. The Immigration Health Surcharge disproportionately impacts essential workers. And in a cost of living crisis, that impact isn't just inconvenient, it's devastating. Scotland's solution is simple: expand IHS reimbursements to include every care worker, not just those with a professional license. If accepted, this move could save migrant carers thousands of pounds across their visa stay and make Scotland a much more attractive destination for ethical recruitment. Section 4. Not working for Scotland. A call for regional flexibility. At the heart of Scotland's argument is one powerful claim: that the UK's one-size-fits-all immigration system is failing Scotland. They don't just say it in passing. They open their entire proposal with this clear, direct message: the immigration system as currently designed does not work for Scotland. That's a bold statement from a government body, and they back it up with real evidence. For one, they highlight the damaging effects of UK-wide salary thresholds. In Scotland, wages in many sectors, especially care, are lower than the UK average, but the rules don't reflect that. The Scottish government explains, the current skilled worker salary threshold of £38,700 is a barrier to individuals being able to move to or take up employment in Scotland. They go further, showing how this threshold locks out 40 to 50% of all working adults in Scotland from ever sponsoring family members, and that number rises to 75–80% for working women. These aren't just statistics. These are migrants, families, and potential contributors to Scotland's care sector, being pushed out by policies designed for London, not for Edinburgh, Dundee, or the Highlands. That's why Scotland is calling for regional exemptions, rules that reflect their local economy and their unique needs. One of their most practical ideas: a Scottish exemption that allows care workers and students in Scotland to still bring their dependents, even if that's banned in the rest of the UK. As they put it, this differential approach would be mutually beneficial to both England and Scotland, incentivizing migration to Scotland, where immigration is an essential lever to bolster local communities and economies. The goal isn't to oppose immigration control, it's to tailor immigration in a way that works. And according to the Scottish Government, that means recognizing the demographic challenges they face, the unique reliance on overseas workers, and the damage done when centralized decisions ignore regional needs. Section 5. What happens next? Scotland's message to Westminster. After laying out the data, the challenges, and their proposed solutions, the Scottish Government ends their 2025 immigration response with a warning and a clear political message to Westminster. If the UK government refuses to make changes, Scotland is signaling that it may push for something bigger: devolution of immigration powers. Here's what they state directly. Failure to take this opportunity would serve to suggest that the only way for the people of Scotland to ensure that the immigration system is reflective of their needs would be through the devolution of those powers. This is not just a policy suggestion, it's a line in the sand. Scotland is saying, we've shown you the evidence, we've presented fair regional solutions, but if you won't adapt the system, then we should have the power to do it ourselves. This is part of a broader vision Scotland outlines in the paper, one where immigration is fair, family-friendly, flexible to local needs, and designed to encourage long-term contribution, not just short-term numbers. They stress again that framing migration solely as a discussion about whether numbers go up or down is unhelpful. Instead, they're calling for a system that recognizes the human side of migration and its importance to Scotland's care sector, economy, and future population. If the UK Home Office continues with its centralized, restrictive approach, this proposal could become a major political turning point, not just in immigration, but in the wider question of how much control Scotland should have over its own future. So, what do you think? Should Scotland be allowed to set its own visa rules, especially when it comes to care workers and family migration? Do you support the return of dependent visas just for Scotland? Let us know in the comments below. We want to hear from care workers, employers, migrants, and anyone affected by these rules. And if you found this video helpful, please give it a like, subscribe to VisaPathway UK, and turn on notifications so you don't miss our next immigration update. We're committed to keeping you informed. Every rule, every change as it happens. Disclaimer: this video is for informational purposes only and does not constitute legal or immigration advice. Always refer to the latest guidance from the UK Home Office or consult a qualified immigration advisor for support with your specific situation.